shoulder forward. Again, she's supine. And then you tell her, hold that shoulder off the table. Don't let me push it down. Okay, that's only if she's supine. Now, she's seated on, is this your back shoulder too? It's fine. Okay. She's going to lift her arm up. I'm going to tell her, hold her arm, and I'm going to push laterally on the, thank you. I'm going to push medially on the lateral border of the scapula. So it look like this. Okay? I'm pushing the arm down and pushing medially. I'm doing two actions, yes. Okay? She's holding her arm up. That's all she's kind of doing because she's stabilizing that scapula. I am pushing down and pushing medially on the lateral border. Serratus anterior. Okay, traps. How do we test traps? You're all too busy videoing. Shoulder stretch. Amy, shrug your shoulders up to your ears. Don't let me push down. Cranial nerve 11, right? Yeah. SCM. Amy, bring your head down. Look towards me. Don't let me pull your head back. Okay. Or go like, Amy, push. Don't let me. You push into my head. I'm going to try to push back. Okay. Subscapularis. Okay. Does medial rotation and adduction. So her hand gets on the small of her back. Amy, don't let me lift off your hand. Okay, don't let me lift off your hand. Okay, subscapularis. Infraspinatus and teres minor, we can do at the same time. Hold right there. She will be performing lateral, I can think of more thinking, lateral rotation, lit, L-I-T, lateral rotation, infraspinatus, teres minor. So Amy, I want you to do this. I want you to keep your elbow close to your body and push into my hand. Good. Again, remember you had to demonstrate that one because if I say push into my hand, she's going to want to lift her elbow.
So did you say this was for infraspinatus, teres?
And teres minor.
Oh,
no.
Those two only.
Those two only.
That covers those two.
Mm-hmm.
Okay.
Supraspinatus, she's going to empty her can out because Superman can't fly and drink at the same time. Right? Okay, so she has to empty her can out. There's two ways you can do it. You can do it in scapular, in the scapular plane, and you're going to, she's going to hold, you will push down to the opposite hip. So Amy, don't let me push down. This one is better if you stand in front of them though. Amy, don't let me push you down. Okay? You can also do with them, that's not a good view, you totally need to get rid of that. Or you can do it straight in front, as I think how we talked about it last week. Amy, don't let me push you down. And again, you're coming to the opposite hip. So in any of those two planes. Okay. Biceps, we know how to do. C5, right? Or an alternate test for C5. Amy, I want you to bring your fist to your shoulder. Hold their elbow. And go ahead and bring your fist to your shoulder. Okay. If you're doing it right away, one after each other, you can do triceps in this position. Now, Amy, push down into my hand. Or you could have her go into extension. And Amy, I want you to bring your arm like that. Okay? Go ahead, push. Okay? Triceps either way. Latissimus dorsi. She's going to do a lat pull down. So Amy, if you've never been to the gym before, this is how you would do a lat pull down. Let me move your arms for you. Bring them down like this. And I'm going to push that way. So Amy, squeeze really tight. Hold it right there. Don't let me push. And I'm going in that direction. Okay? Don't let me push. Just like that. Okay? Deltoid. We have the anterior, middle, and posterior. Middle, she's going to pull forward. So I'm going to say, Amy, bring your elbow forward. I'm going to raise this. Just do it. Yeah, there you go. Okay? That's the anterior. Anterior, we're bringing things forward. Middle, we know how to do. This is C5. Amy, don't let me push down on your elbow. And then posterior, she's bringing everything back. So Amy, push your elbow back into my hand. Okay.
What was middle?
Huh? Middle C5. She's doing abduction of the shoulder. Okay. Brachioradialis. Amy, I want you to hold your arm here, and this time I want you to bring your fist in this position to your shoulder, and I'm going to try to stop you. Good.
So that looks like
brachioradialis is this way, like you're doing a hammer. Okay, so thumbs up. Bicep is going to go here, okay? So you can remember bicep, the function or the action of the bicep is elbow flexion, also helps with supination, so you can remember to do it that way, okay? Biceps, brachioradialis.
That's like a hammer curl.
Exactly. Flexor carpi radialis, flexor carpi ulnaris does wrist flexion. Amy, bring your arm out straight, make a fist, bring your fist down. Don't let me pull the fist up. You know how to do this one. Stand in front of the patient. Standing back here. Extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris, wrist extension, just like C6. And fist up, Amy, and don't let me pull your fist down. Again, stand in front of the patient for that one. Flexor carpi radialis, extensor carpi radialis longus, abductor pollicis longus, extensor pollicis brevis. That does radial deviation. Amy, bring your hand out like this and tilt it in towards your thumb. Don't let me straighten your hand. Okay, best if you're standing in front of the patient for that one too. Okay, we're going to do flexor carpi ulnaris, extensor carpi ulnaris, ulnar deviation. Now this time tilt towards your pinky. Don't let me push your hand straight. Again, stand in front of the patient. Opponens pollicis, flexor pollicis brevis, abductor pollicis brevis. Opponens digiti minimi is opposition of the thumb and the little finger. So Amy, make a OK sign or number 3. Don't let me pull your fingers together, squeeze them. Okay, just between the thumb and the pinky. Flexor digitorum profundus, flexor digitorum superficialis, lumbricoles interossei, flexor digiti minimi, finger flexion. Amy, bring your arm out straight. Curl your fingers in between mine. Don't let me straighten your fingers. C8, okay? Finger flexion, C8. And then we'll do psoas since we already know how to do psoas. Psoas, lift your knee into my hand. Don't let me push it down. Let's do all of them since you guys have the videos on. Okay, quadriceps. Amy, I want you to kick your heel towards the bottom of the table. Okay? I want you to bring
Hamstring.
Hamstring. What did I say? I did say quads? Oh, I skipped. Let's do hamstring since we're already down here. Well, we can do quads. Let's do them in order. Quads, kick out. Okay? That's L3. Hamstrings, I want you to pull back with your heel. Okay, hamstrings. Hip adductors. So we talked about these with the 5-minute neuro too. Careful of hand placement. So she will be doing hip adduction. She'll be squeezing her knees together. Do not place your fingers here. Fingers are going to go down. Amy, I want you to squeeze your knees, and I'm going to try to resist. Don't say I'm going to pull your legs apart.
Spread them.
Yeah. Hip abduction. Yeah, this one you're not going to say spread them. Hip abduction. Amy, I want you to push your knees out into my hands. Good. Gastroc and soleus, real easy. Amy, stand up for me, please. Oh, you can do it 2 ways. Hold on up there. We can do it 2 ways. I want you to push into the palm of my hand. Good. Or she can stand up. And stand on your toes for me, please. Either one. And then what's the last one? Tibialis anterior. Have a seat up here. Oh, I should have done it the other way. That's okay. I want you to lift up there. Don't let me push down. Good. And then stand back up. Sorry. I know.
Or you could do it this way, you're saying?
And then stand on your heels. Okay. All of these we've done. Most, okay, besides those 2.